Hi, I'm Dr. Carl Bamlet, and today we're going to share with you a few health tips.
Carl, if somebody does injure themselves, or when someone gets a bit of pain or discomfort from some sort of movement or injury at this time, what's the best prevention? What are the best types or less damaging sort of painkillers that somebody could take or use to help manage that inflammatory response?
Very good question there, Paul. There's a few things that we can do preemptively. If we're staying active a lot and we're doing things to just try and keep ourselves from, not getting too injured. Managing that inflammatory response is one of the best things that we can possibly do. And if we get the right types of oils and fats and things into our body, we have a more beneficial response that will give the right amount. If we roll our ankle, an inflammatory response is beneficial. Quite historically, it would have been because it would splint the ankle, make it so you could hobble away and get to where you needed to. Nowadays, a little bit more of a nuisance, but it's still the appropriate response for the body. But if we have that chronic inflammation, normal activity without an injury can cause a lot of pain and fatigue and can actually lead to an injury where we tear something or have something going off. So managing that inflammatory response between the omega-3 and omega-6 fatty acids is a really big thing. And people have probably been hearing a lot about the omega-3 versus omega-6 fatty acids in the news. And we'll give a bit of a quick recap here. So the omega-3s are the anti-inflammatory, good quality ones, which we're deficient of. They're both good, but we're deficient of the omega-3s because we don't eat as many of them. The omega-6s are the ones that aren't quite as beneficial because we have so many more of them in our diet than we would have otherwise. If it was the other way, if we were eating way too many omega-3s and not enough omega-6s, it would be beneficial the other way around, but that's not the way it is. We're eating more of the inflammatory, pro-inflammatory, rather than the anti-inflammatory. So we got to try and build up some of those pro-inflammatory or anti-inflammatory omega-3s and get rid of the non-beneficial omega-6s. So some things that we can do that people may have heard of, but just really trying to hammer that down is fish oil is a really good thing to take down inflammation. If you get 2,000 milligrams a day of fish oil, that's a real good level to get a baseline starting. And this isn't going to be an immediate fix. This is a slow and steady process that will make the body feel better little by little by little by little, and eventually the pain is going to be gone. That's what you see in clinic all the time with people. They start doing it, it starts to feel a bit better, and that chronic nagging pain tends to start going away. For a little extra up, if we want to take down those omega-6s response, the inflammatory ones which are doing the negative impact on the body, turmeric is one of the best things we can do. Turmeric is real good for taking away the bad inflammatory response and not harming all the other little inflammatory responses. People may have heard of the Cox and Lox mechanisms, and it takes away the ones that we want to get rid of that are causing the inflammation, causing the pain, and it spares some others. So it affects the COX-2 and the LOX and the inducible nitrous oxide synthase. That's what turmeric affects. And we'll get into what the other anti-inflammatories affect too. And then we get down to boswellia, which is another good anti-inflammatory herb, and that inhibits 5-lipoxygenase. So we're affecting those LOX-COX mechanisms. You don't need to know those words too much, but that's what we're trying to affect with these. So turmeric, fish oil, boswellia are great maintenance, and you can even use them as after an injury to try and take away the pain too.
Nice. You mentioned we've got a lot of the omega-6 in our diet. What are some examples of foods which are high in omega-6 or promoting those high levels of omega-6 in our diet?
Great question. So high omega-6 are going to be grains, processed foods, rancid fats will have some omega-6s in there. And then we're going to get into some of the other things which, if we have meats that are fed high grain diets, or if they're processed a lot, that's going to be another thing that will be a bit more inflammatory. So those are some of the places to look for it.
Thanks, Scott. That's really useful information. That's great.
Thank you for watching our video. This has been Dr. Carl Bamlet, the Modern Caveman, helping you live your modern day life using wisdom from the past. Thank you.